Hello, this is a call to mobilize stakeholders to take action to support community programs for youth. My name is Amanda Phipps. I was lucky enough to intern with Healthy Acadia this summer as a community health intern to fulfill the requirement for my master's degree in public health with SNHU. My practicum projects included meeting with the Downeast Youth Action Team and the Gateway to Opportunity, known as G2O representatives, to discuss relevant issues they thought the youth would want presented at the Downeast Teen Leadership Camp, also known as DETLC. The Downeast Teen Leadership Camp is a week-long resident summer camp in Downeast, Maine that invites local young teens entering grades 7 through 9 to learn about substance prevention, communication skills, social issues, mental health, leadership skills, and all kinds of different life skills, from cooking to reproductive health, through workshops, guest speakers, and team building activities. The Downeast region ranges from Hancock to Washington counties on the coast of Maine. Vaping tobacco is a growing problem within the teen population today, and the Downeast district is doing significantly worse than the Maine state benchmark. So I designed a workshop on tobacco prevention, focusing on vaping, that was audience appropriate and presented to engage the camp participants in a meaningful way with open conversation and having them ask questions about things they wanted to know, giving them planned activities to practice conversation skills. We also talked about facts and myths around vaping and tobacco. I have linked the videos associated with that presentation at the end of this video. I gave a pre-test and post-test in the workshop on some of the health effects of tobacco, and the results show that they learned a lot, despite most of them reporting having attended substance prevention assemblies in their schools. But research shows that repetition is key to having this kind of health information sink in. The test scores shows that the teens increased their knowledge from an average pre-test score of 57% to an average post-test score of 96.7%. So that also means that they were engaged enough to retain that information. Being able to present health information to teens was a great experience for me. They were much more involved in the open conversation than I expected, and they showed concern about their future health and that of their friends. Another part of my project was evaluating the Downeast Teen Leadership Camp in its process, outcomes, and impacts, because this camp has been hosted for years in various forms and in different locations. First, I created a logic model here to visualize the inputs, outputs, activities, short-term outcome, intermediate outcomes, and impacts, and also think about how to measure process versus impacts. I added fields for assumptions and contextual factors to consider. As part of the evaluation, I conducted a pre-camp survey and a post-survey of the campers and youth staff. You can see the templates of the pre-test and post-test surveys here. And I was able to also conduct a focus group with some of the youth staff to ask about their behaviors and attitudes concerning substance use, their peer groups, their community involvement. You can see the focus group questions here. I organized the responses into an Excel document, color-coded each response, and grouped them into themes, as you can see here. And then I wrote a discussion of the results at the end of the analysis. The results from these activities gave some great insights about this age group. ages 12 to 21. Of the 48 responses from the pre-survey, there were 4 youth staff 18 and over, which may have skewed the results a little because substance become legal at 18 and 21. I made a PowerPoint presentation of the survey findings after analyzing the Excel results that you can see here. And here you can see some of the charts I used in the PowerPoint presentation. This year, most of the participants were from Washington County. Most had attended this camp before, and most do not attend any other camps through the summer. Most participants thought the activities at DETLC were useful and that DETLC has given them knowledge and tools to help support making good decisions. Responses from the survey showed that 87%, more than 87%, do not engage in any type of substance use. And those who do are more likely to use alcohol or cannabis, which become legal at 21. From the responses in the focus group, there was a consensus that people their age don't consider alcohol and cannabis dangerous or serious substances because they are legal for adults and socially acceptable. This was an interesting finding and one that could be addressed in future community work. Evidence from academic research shows that community engagement is essential for substance prevention in the youth population. By engaging with the community, kids and teens gain knowledge, learn skills, have experiences that influence behavioral health. There's also evidence that shows community involvement is not only an opportunity for personal growth, but it can also act as a social trend, building positive behavior, engagement, and connectedness. DETLC has done a wonderful job doing this. In my evaluation, I found that DETLC has had notably positive effect in the areas of deterring substance use, increasing social connection, and improving mental health on the youth who have been involved. Educational opportunities and job prospects have been positively affected as well. It was interesting to hear them report that the prevalence of substance use within their cohort is perceived as high, but they feel that their camp experiences have given them tools to avoid substance use and resources to offer others help if they need it. When asked about strengths and weaknesses of the camp, there were a few respondents who suggested expanding the reach of the camp by running it for either more than 1 week or using a larger campus for more space for participants to stay. And whether or not this is feasible because it's a grant-funded program, I think it's a resounding endorsement of the camp, and I was happy to be part of it this year. I created a quality improvement plan you can see here for future DETLC sessions based on data collection from planning meetings with camp counselors, Downeast Youth Action Team, and G2O reps, DETLC 2023 surveys, focus groups, and observations. This does consider contextual factors and barriers. This plan was originally supposed to be focused on improving cultural competency, but I expanded the scope to also address building on success in other areas. So thanks for listening. I look forward to seeing your artifacts and hearing your feedback. Take care.